I am Dr. Vivian Cole, a urologist, and I am going to rip the bandage off a highly taboo subject that is quietly destroying the vascular health, morning rigidity, and baseline confidence of millions of men. We need to talk about the physical, mechanical damage being inflicted on your pelvic floor through aggressive solo habits, and why this seemingly innocent routine is the exact reason your morning vitality has completely disappeared. There is a massive blind spot in men's health right now. Men are constantly bombarded with the idea that if they lose their morning response or struggle with intimacy, it is strictly a dopamine issue, a psychological addiction to screens and novelty. While neurochemistry plays a role, this narrative entirely ignores the devastating mechanical trauma occurring at the tissue level. I see this reality in my clinic every single week. Men in their 40s and 50s sitting across from me, deeply embarrassed, explaining that their physical response feels completely numb and that their morning wood is a distant memory. They assume their testosterone has crashed. What they do not realize is that years of high-friction, hyper-stimulating solo habits have actively traumatized their peripheral nerves and microvessels. By the time we finish this discussion, you will understand the exact structural damage you are causing to your own anatomy, and I will give you the precise biological protocol to regenerate those nerve pathways and restore your vascular response. To comprehend why this happens, we have to look closely at the microscopic architecture of your anatomy. The sensitivity and vascular response of your pelvic region rely on an incredibly dense network of peripheral nerve endings called Pacinian corpuscles, which are responsible for detecting physical sensation and signaling the brain to initiate vasodilation. Furthermore, the blood that creates a rigid response is trapped by a fibrous envelope of tissue known as the tunica albuginea. When you engage in aggressive, high-friction solo habits, what clinical literature sometimes refers to as the death grip syndrome, you are subjecting these delicate tissues to a level of mechanical stress and compression that they were never biologically designed to handle. Over years and decades, this chronic hyperstimulation does two disastrous things. First, it causes severe downregulation of those Pacinian corpuscles. Your nervous system physically adapts to the extreme friction by blunting the receptors, essentially turning off the volume to protect the tissue. You become clinically desensitized. Secondly, the intense mechanical pressure creates microscopic tears in the tunica albuginea. As these microtraumas heal, they form rigid, inelastic scar tissue. This scarring prevents the tissue from expanding fully and creates microscopic leaks, meaning the veins that are supposed to trap the blood are compromised. You are essentially trying to inflate a tire that has dozens of microscopic punctures. The profound clinical error men make is rushing to their doctor for synthetic PDE5 inhibitors, the conventional blue pills, thinking more blood flow will fix the problem. But if your nerve receptors are blunted and your structural tissue is leaking, pouring more blood into a compromised vessel does absolutely nothing to restore sensation or baseline morning vitality. You cannot chemically force a response in tissue that is physically traumatized. To reverse this localized neuropathy and restore structural integrity, you must intervene with a protocol that enforces tissue regeneration and upregulates your nervous system. The absolute first intervention is a non-negotiable mechanical reset. You must completely eliminate all high-friction, aggressive solo stimulation for a minimum of 21 days. This is not about moralistic abstinence. This is a strict physiological requirement. The peripheral nerve receptors in your pelvic floor require a complete absence of extreme mechanical stress to begin upregulating their sensitivity. By removing the hyperstimulation, you force the nervous system to recalibrate its baseline. It is exactly like stepping out of a deafeningly loud concert and waiting for your ears to readjust to normal room conversation. During this 21-day window, your body begins to clear the localized inflammatory markers caused by the microtrauma, allowing the smooth muscle to finally rest and the microscopic scarring process to halt. The second crucial action involves executing a localized thermal flush to actively repair the vascular microtrauma. When tissue is subjected to chronic compression, deoxygenated, inflammatory blood often pools in the deep pelvic floor, creating a toxic environment that prevents healing. To break this stagnation, you must utilize temperature contrast. During your daily shower, you will apply a cold stimulus directly to the lower abdomen and pelvic region for 30 seconds, forcing extreme vasoconstriction. Immediately following this, you switch to warm water to trigger reactive hyperemia, a massive rush of fresh, highly oxygenated arterial blood back into the tissues. This mechanical pumping action literally flushes out the inflammatory byproducts of your solo habits and delivers the vital nutrients the tunica albuginea needs to repair its microtears and restore its elasticity. If having a physician finally explain the actual physical mechanics behind your loss of sensation and morning vitality, without the shame or the vague psychological jargon, is the kind of clarity you have been searching for, please take a moment to subscribe and leave a like. It is the only way we can bypass the generic algorithms and get this specific, targeted medical truth to other men who are silently dealing with this exact same frustration. The third mechanism involves fundamentally altering your internal hormonal signaling to support pelvic floor relaxation and nerve repair. Even if you rest the tissue mechanically, if your internal environment is inflamed, the pathways will not open. A major hidden culprit in men over 40 is the accumulation of DHT, a byproduct of testosterone, which causes the prostate to enlarge and become inflamed. An inflamed prostate puts immense physical pressure on the surrounding pelvic floor muscles and the pudendal nerve, keeping the entire region in a state of chronic ischemic tension. You must actively reduce this internal pressure. The practical approach here involves deep diaphragmatic breathing combined with a specific focus on dietary compounds that soothe prostate inflammation, allowing the physical tension in the pelvic bowl to release so that blood can flow freely while you sleep, which is the absolute prerequisite for morning rigidity. For the first 12 years of my clinical practice, I firmly believed that behavioral modification was the only valid approach to this problem. I built my protocols entirely around dopamine detoxes, the 21-day mechanical rest, and pelvic floor physical therapy. I actively dismissed the concept of natural supplementation, viewing it as a crutch or simply a placebo marketed to desperate men. I wanted my patients to heal strictly through discipline and time. However, the reality of clinical practice eventually forced me to confront my own professional stubbornness. I was seeing a specific demographic, men right around the ages of 45 to 52, who were following my behavioral rest protocols flawlessly. They stopped the habits, they did the thermal contrast, but their physical numbness and lack of morning response remained stubbornly entrenched. Decades of mechanical trauma had created an environment where the brain-to-pelvis signaling axis was simply too dormant to wake up on its own. The physical rest was preventing further damage, but it wasn't enough to trigger active regeneration. I went back into the endocrine and botanical research, searching for compounds that could physically force that physiological communication back online. The protocol I ultimately developed and integrated relies on a highly specific, synergistic combination of two powerful natural extracts. The first is a concentrated form of Tribulus terrestris. I utilize this because it actively stimulates the release of luteinizing hormone, or LH, in the brain. This sends a powerful, endogenous signal straight to the testes to ramp up baseline testosterone production, essentially turning the volume of your biological drive back up and forcing the dormant peripheral nerves to start receiving signals again. The second, equally critical ingredient is saw palmetto. This compound directly blocks the enzyme that converts your active testosterone into DHT. By halting that conversion, saw palmetto drastically reduces the internal inflammation and pressure on the prostate, allowing the pelvic floor to finally relax and the pudendal nerve to breathe. When I introduced this precise hormonal and structural support system to my patients, the shift was undeniable. I watched men in that 45 to 52 age bracket who had been completely devoid of physical sensation for years report a profound return of their nocturnal sensitivity and spontaneous morning rigidity within just 14 to 21 days. This is not about instantly curing a problem with a magic pill. It is about providing the exact biochemical keys required to unlock the physical healing process that behavior alone could no longer trigger. Because I believe you should have total transparency over what goes into your body, I have linked the exact clinically dosed formulation I use in my own practice in the pinned comment below so you can verify the extraction standards and the science yourself. It is absolutely crucial that you understand the long-term trajectory of ignoring this mechanical trauma. When you continue to subject your pelvic anatomy to aggressive friction while ignoring the numbness, you are walking a straight line toward peripheral neuropathy. The nerves will eventually reach a point where they undergo apoptosis, cellular death. When that happens, the lack of morning wood is no longer just an inconvenience. You will completely lose the ability to achieve a rigid response with a partner because the local receptors simply cannot send the required signals to your brain. In my clinic, I constantly see the tragic psychological loop this creates. A man feels his sensitivity dropping, so he mistakenly increases the intensity and friction of his solo habits to try and feel something, which rapidly accelerates the microscopic scarring and nerve damage. This leads to profound performance anxiety, which spikes cortisol, further clamping down the blood vessels. Reclaiming your vitality means stepping out of this destructive cycle. It requires resting the tissue, flushing the inflammation, and upregulating the hormonal signals that rebuild the connection between your brain and your body. Tell me in the comments, have you noticed that it takes significantly more physical stimulation now to reach the same vascular response you had 10 years ago? The peripheral nerve network and the smooth muscle tissue of your pelvic floor possess an extraordinary capacity for regeneration. They want to heal. But you must understand that the tunica albuginea will eventually form permanent, unyielding scar tissue if you continue to subject it to microtrauma without offering it the biochemical support to repair. That window of biological plasticity is open right now, but it begins to close permanently as you navigate your late 40s and 50s. The targeted nutritional protocol we discussed is designed to aggressively intervene while those nerve endings and vascular tissues are still capable of waking up. Take a serious look at the specific formulation and its clinical mechanism through the link in the pinned comment. Do not let a deeply ingrained habit permanently destroy your physical vitality when the biological tools to rebuild it are readily available.